What's up, everyone? AccuDoc Ava here at AccuHealth, and I am getting ready to do some microneedling. This is my AccuMicro pen. This is a medical grade device, and these are the needles that we use for microneedling. Is it upside? It's upside down. That's okay. That's okay. So they come in these wrappers like sterile devices should, right? And it's got a little bayonet on the end so that we can lock it into place in our microneedling device. I love this device. I have been doing microneedling for patients and cosmetic acupuncture also for, let's see, about 3 years now. That I've been doing the microneedling, the cosmetic acupuncture a lot longer, about 10 years. And I love them both. I love them both. So see here, I've got my hair pinned back and out of my way. When I do this, you can see a little bit of line happening, but when I don't do that, you don't really see too much. But I do microneedle myself periodically. Now I'm 2 years fresh from having twins, and then a year after they were born, I did a pretty intense parasite, heavy metal, all that detox, and it caused a lot of detoxing and kind of acne and discoloration, scarring, things like that in my skin. I'm sure it caused hormone imbalance. And trying to re-regulate that it's always a constant struggle, right, ladies? But we're making it through. So this is why I want to do the microneedling. As you can see, I don't really have too many lines, just uneven skin tone and then puffiness here. Not that I'm going to microneedle that or anything. So yeah, I've got my needle tip on here. You can see that. You can't, but here, maybe if I put it this way. There are 12 needles on this head here. They're acupuncture sized needles, and it sounds really painful, but it's not. I'm a little bit of a wuss when it comes to pain. So this, I'm telling you, is very minimally invasive, not painful. You know, a little bit. It's needles puncturing your skin. What do you expect? But so when it comes to acupuncturist microneedling versus estheticians microneedling, I think in general, estheticians will tend to use like up to 2 millimeters in depth into the skin. And, you know, research has shown that you actually only need to go 0.5 millimeter under the skin to stimulate the nerve. That then stimulates the deeper tissues to improve collagen production to repair the area. So half a millimeter in general is just fine. So if you have someone that's doing 2 millimeters and you just can't tolerate it, you can always ask them to adjust, because I know the American way is the more the better, right? If a little is good, then more must be better. That's not true. That's not true. So those nerves are only 0.5 millimeter in general under the skin to stimulate collagen production and repair. So it doesn't need to be painful. So to start, I'm going to use micellar water to cleanse the skin. Nothing too crazy. And then I've got my nose ring here. I'll just take that out. Put it to the side. I don't have any makeup on, but just in case, I'm not freshly washed. And then I can actually do my neck as well. So these lines on my neck, if you could, I don't know if you can see me running my fingers over them, but if you're one of those people that has to look down a lot, you know, if you're doing patient care, if you're studying, researching, This is, you know, your circulation or the flow of lymphatic fluid and detoxing is not happening properly here. So you can tend to get these lines and you can get this buildup. I don't know if you've seen that, where it's like this. You have a couple of rolls in the neck, but, you know, a thin face. So it's not necessarily that you're overweight, but the flow of fluids here is not happening correctly. So you will get those little neck rolls and these necklines. So these are just lines now, but they used to be more like the rolls because of the circulation and the buildup of fluids there. So the microneedling has helped nicely with that. And it really doesn't take too many sessions. So anyway, let's get started. I like to start, I will do 0.5 millimeter. Let's see, it's a very shiny device here. So we're at 0.5 millimeter. And this one has one of the highest RPMs on the market. And what that does is help reduce the drag. Because when you get drag, you get a bigger tear. And I know that sounds bad, but it's on such a micro level that you don't see it, but you want to try and minimize the tear because then that's going to take a little bit longer to heal. So that's why you want to have a medical grade device so that you can minimize the damage and maximize the benefits, right? Okay. So we're going to start here. And you just section out the body. But this I'm going to tell you was uncomfortable and hard to do on myself the first time. But here we are years later. And I've been slacking. That's okay. And it's fairly easy. Now you don't want to be in the sun much. After this, you don't want to go work out because then you're going to get sweaty. And this is an open wound. So you definitely want to keep it clean and dry. And for people like, you know, my husband who run hot, doing this on the scalp is great because it helps to cool them off. It's almost like a release valve on the head. You start to stick a little bit like I am. Just put a little bit more on there. There we go. So this can help with that turkey neck, that line there. And the substance I'm using, I just like to use hyaluronic acid, but we do have lab grade herbal products that we use. I save those for patients to help with the tone of the skin, or if you have thin skin, you just want to even out the color or lighten some dark spots. There's all kinds of different topicals you can use, and this microneedling is going to increase absorption by, I think it's about 3,000%. It's pretty high, which is crazy. You want to try not to go over any active acne. But see, even this doesn't hurt much. I have a little scar right there, so I can go over that a little bit a couple times. The upper lip is a sensitive spot for anyone. And then I have some discoloration here, so I'll just kind of go over that too. It's a fairly simple process though. You want to make sure your hands are nice and clean too, please. I'm not using gloves because this is my face, but in general, when treating patients, wear gloves. I was saying it's fairly simple. And you can see I have a little bit of damage right here from a Biore pore strip. Can you believe that? 20 years ago. Okay, so now for the forehead, the skin is very thin there. Or there's just bone right under there for most of us. So that can be pretty painful if you go deep on there. So I'm just gonna go all the way down on mine. You see that? 0. So it doesn't mean it's not coming out of the tip at all. It's just gonna be very superficial. And that's all you really need. You don't need it to be very deep here. And there we are. This is the after. If you feel like you didn't get any spots good enough, you can go back over. So some of these areas where the scarring is a little bit more visible, I'll go back over those areas. Now I'll have to find an older video. I have this discoloration here. It used to be a lot more noticeable. In this light it's hard to kind of see it, but when I pull it down like this you can definitely see it. So, right there. You see? I'll have to see if I can find a photo with where it's more noticeable. And that's it, not much to it. And I feel like after I do that, my skin looks so much healthier and better anyway, because I've used the hyaluronic acid, and you can see here, it started to get a little red, but it's not too bad, not irritating to me at all. But obviously I don't want to go work out, like I said, to cause any sweating, be in the sun, expose, you know, go play in the dirt and then touch my face. That would be bad. Definitely not something you want to do. And then it's okay that my hair's not in my face because, you know, there are oils in there too. So anyway, simple enough. It didn't even take 20 minutes for that whole process. If you have any questions, I love this stuff. I will do a video how it looks. I really feel like it makes the skin pop a day or two after, so I'll have to post another video in a day or two just to show you guys what the results. Anyway, I love microneedling, minimally invasive, and it doesn't have to be very painful depending on the practitioner, right? So I hope you found this helpful. If you have any questions, please let us know. Hit the subscribe button for more content like this. Thanks and have a great day.